Hello, and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing how psychedelics may help alleviate mental health impacts of racial trauma with Dr. Monnica T. Williams. Dr. Williams is a licensed clinical psychologist and professor at the University of Ottawa in the School of Psychology, where she is the Canada Research Chair in Mental Health Disparities. Now, before we get to Dr. Williams, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, as always, if you are a clinician and you would like to learn more about psychedelics so that you can answer all those questions that we know your patients are bringing to you, please check out the Psychedelic Medicine Association. It is our mission to get you up to speed and feeling comfortable to discuss psychedelics with your patients. And you can find us at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Dr. Williams.
Thank you. Thanks for having me.
I'm really looking forward to this discussion, and I also know that people will. I think this episode will come out after you've already presented in Denver, but I'm looking forward to seeing you present at the Psychedelic Science Conference in Denver as well. Everybody will just have to live vicariously through the recording. So since this comes out in like 2 weeks, but I'd love to start by asking you about the traumatizing impact of racism in people of color.
Yeah, absolutely. It's a really important and serious problem that I think has gone on under the radar for a long time. People of color who live in sort of these white dominated Western contexts are continually bombarded by subtle and not so subtle messages about their worth, about their standing in society, about their intelligence, their character, on and on and on and on. And so it's really the daily onslaught just wears and wears away at people. And the stress of it can actually become traumatizing. And sometimes it's, a big thing that happens that traumatizes people, but sometimes it's just the weight of all of the things combined that come together and cause trauma. And we see these symptoms of racial trauma. They look pretty much like PTSD. You'd be hard pressed to tell the difference just looking at the symptoms. So it's pretty safe to say that racism can be traumatic.
And does it have to do with, I'm figuring, like you talked about, there's the big causes of trauma and then the everyday causes. And it would seem to me that the everyday causes would be the lack of, at least partially related to like a lack of feeling of safety.
Yeah, absolutely. That's a part of it, and that can also be a part of what gets in the way of people healing and overcoming these traumas. And so you have to remember it is the daily grind of racism and its interpersonal experiences, but it's also things like community trauma, historical trauma, cultural traumas, things that we carry with us, from our ancestors, in our communities, from our families of origin, that also sort of contribute to this weight. So I can be 1,000 miles away in another country and watch the video of George Floyd being murdered and be traumatized. My niece can watch that in Germany and be traumatized because we have that shared cultural history, that shared cultural baggage and cultural pain that makes it so much more real for us.
Yeah, absolutely. And I saw toward the end of your paper, you mentioned some of the most highly endorsed in the we'll be discussing a survey that you put out, but there were two experiences that a whole lot of people brought up. And you discussed a little bit about how those two experiences were easy to see how they would lead to something like depression because there's, I think like you said, we talk about PTSD and we're talking about trauma and I'd love for you to discuss a little bit about how that racial trauma ends up manifesting in something like PTSD or something like depression or anxiety.
Yeah, good question. I mean, we know, for example, PTSD, when people have experienced traumatizing things, it kind of puts your nervous system on high alert because you're kind of constantly looking out when is the next trauma going to happen? When's the shoe going to drop, right? Just like the veteran who comes back from overseas, he hears a car backfire and it's like, oh, it's a bomb, right? It's something I need to be afraid of. And it's the same thing with racism, except the targets are people. Like anybody can exhibit racism at any time. You don't know when it's going to happen, so it's unpredictable, which is a recipe for anxiety right then and there. And and then we know that people are having nightmares about these things. Their minds working overtime trying to chew and process them, and then people feel helpless, and that helplessness leads to depression. All of these things, signs of racial trauma, all of them common symptoms of PTSD as well.
Yeah, and I would love to take this opportunity in case, it doesn't show up on somebody's radar in any other setting. Would you mind discussing a little bit about intersectionality? Because people aren't just a person of color. They may be a part of more than one group that feels unsafe. For example, like the intersection with women or the LGBTQ community.
Absolutely. So, I mean, I can talk about myself as a Black woman. I know that the racism I'm going to experience in my daily life is very different than the racism that a Black man is going to experience. I mean, and I can give you one example from a few years ago. I have lab meetings every week. I expect my grad students to show up on time for the lab meetings, and I had a Black male student in my lab, and he was constantly late for lab meetings. And at one point, I'm like, you need to come on time for the lab meetings. And he's like, I'm sorry, I got pulled over again on my way in. And it was the same road I'd driven down a million times. No cop pulled me over, but because he's a Black man, he gets pulled over. And I'm just like, oh, geez, I'm so sorry. I didn't even think of it, right? Because the two of us are experiencing racism differently. In this case, because of our gender, but it can be for other things. It could be sexual orientation. It could be stigmatized religious identity, combined with race or gender or any number of these identities that tend to be marginalized.
Yes, thank you for that. I had that. In fact, like I actually thought a different thing going in when you said, as a Black woman, I'm going to have this, and the trace. It was actually the Black man that was having a more stigmatized experience in that. That's well, thank you for sharing that. At this point, before psychedelics, we were getting to that. Is there any current treatment for racial trauma?
Well, the treatment for racial trauma, there are some, um, behavioral treatments, some therapeutic approaches that have been described in the literature. There haven't been any treatments for racial trauma that have actually been empirically tested as a comprehensive treatment approach. There have been different techniques that have been shown to reduce racial trauma, but not by any stretch whole treatments. And in fact, this is something our lab is working on. We have a 12-step CBT approach for racial trauma that we're piloting now. But, we don't have any, we haven't published the results yet. I mean, they look promising. But nobody's done this work and not for lack of desire. Also, we are beholden to the funding that we can get to do the studies, right? And this is not the kind of thing that has been prioritized for funding. But frankly, even if I had a big NIH grant, you know what? It'd be gone now because those have been all taken back. So it's hard to even just get money to do the study to show that the treatment is effective. So there's been very, very little in terms of, empirically validated approaches.
And we know trauma that isn't like you said, just PTSD of whatever source is always been traditionally difficult to address regardless of the cause. And I'm assuming that the hypothesis would be that there would be some overlap with the treatment of PTSD and some aspects that would be unique to racial trauma.
Absolutely, and that's the approach that we're taking in our treatment protocol. I mean, first of all, a really important piece of this is understanding, just understanding like how did I get traumatized, right? What were the things that caused it, and what is keeping it going? And so the first part of the treatment approach that we take is a psychoeducation, understanding the nature of racism and how insidious it is and how people feel gaslit from their experiences. How I can point out to a white friend, I just had that racist experience, and the white friend could be like, "Oh, I didn't see that. Like, really? What are you talking about? Are you sure that's what it was?" Like, we can see the same things, but actually see something different because of the way that we're socialized, whether we have to, as a person of color, be able to recognize racism for my own protection versus someone who may be socialized intentionally not to see it because that's because that's a more effective approach to maintaining the problem. And that's how white people in our society are socialized to actually not see the problem that's right in front of them. And so part of being able to heal from trauma is, and this was actually something a very like wise mushroom told me once.
I love that.
that, that, that says trauma heals. People heal from trauma when someone witnesses your pain, right? When people can compassionately witness your pain and join in it with you. This is the basis behind, all therapeutic approaches for trauma treatment, even though people wouldn't describe it that way. But when another person can't even see what you've experienced, how can they witness your pain, right? How can you move forward?
Yeah, absolutely. Well, thank you for that. And I would love to hear about, and I know you said that there's so little funding for it, but at some point in time, luckily you guys were able to do a study. And so can you talk about, how you designed the survey and we'll start with there, the
Yeah.
purpose of the study and how you gathered the information.
Okay, well, we have a couple pokers in the fire, and we'll see how many we have time to get to today. But we did a survey study actually across the United States and Canada, where we just asked people of color, like, have you used psychedelics for racial trauma? I just put it straight out there. We weren't even sure anyone would respond because we know there's so much stigma around psychedelic use, especially in some of these communities that are targeted for drug use. We weren't sure that anybody would even respond to our survey, so we were very pleasantly surprised that many people shared this. They talked about they were asked to think of a really like a memorable experience of racism and a memorable experience of using psychedelics to deal with that. And what were they feeling before? What were they feeling after? How did that happen? Did their symptoms improve and by how much? And we saw that many people of color are using psychedelics to manage racism, often very quietly. Um, but it seems for many people to be quite effective and quite helpful. And so this was sort of the first step that we need. Obviously, this is a far cry from a randomized controlled trial, but this gives us the data that we need to say, okay, there's something here. And let's look at this a little closer and let's do some more studies where we can actually, and now we can justify a study where we're giving somebody a psychedelic to see if and how their racial trauma symptoms may improve or change.
And what were the findings? I remember at the end of the article you said like, yes, obviously it's skewed because people reported, in certain ways, but the findings were still pretty remarkable. So I would love to
Yeah.
hear, how many, like you said, it was difficult to find people, but you did. And so how were you able to find people and what kinds of things did you glean from the study?
Right. So we did sort of a national survey. Like I said, we were looking to be representative geographically, have people from all of the different states and provinces. We were looking more at the young adult age group, but it was a pretty wide net. And we found, yes, people showed large sustained improvements. Now, not everybody. Some people, didn't improve, but a lot of people did that we said, wow, this is big. And also, we wanted to look at other things that were related to these improvements. And so one of the things we found is that the intensity of the psychedelic experience made a big difference, and also the environment the person had the experience in, if they felt safe, right? This was a big piece of it too, because if the person didn't feel safe, then sometimes that equated to a bad experience, and we have to think about the world so many people of color live in. Sometimes we don't think about what needs to go into your setting, right? You talk about set and setting. What needs to be a part of your setting to feel safe. And if you're not in a safe neighborhood, then that's going to play out in terms of your experience as well, right? So how far can you go down the psychedelic rabbit hole if you don't know if police are going to be knocking at the door, if you're going to hear sirens in the street, or if you're safe at all, right? So this is also something that we saw coming out of the study is really like the importance of that safety.
Yeah, absolutely. What did you see as far as mental health variables, how they were before and after their experience?
Yes, so we saw improvements, we saw reductions in stress, in depression and anxiety and in trauma symptoms related to discrimination. So all of these, large measurable effect sizes in terms of the reduction of these symptoms.
And did they mention in the survey whether they had tried other things that had not been helpful?
Well, we asked people everything they tried, and some people had tried a lot of things, and if they, we didn't include them in the survey, like we didn't include cannabis, and we didn't, I mean, um, so we did try to isolate. We looked at some separate psychedelics where we had enough people who described a specific one, like psilocybin or LSD or peyote in some cases. And so we were able to look at those psychedelics separately, and we didn't actually find a difference. It didn't seem to matter which psychedelic it was. It seemed that they were all more or less equally effective. Now, of course, they weren't randomly assigned, so it could be people are picking the psychedelic that is best for them, which is good, which was what we want in the end anyway. So.
Yeah, absolutely. And I noticed that you noted that there was a decrease in traumatic stress, but also a decrease in depression and anxiety. And you had noted that like the reduction in depressive symptoms, what being similar to the reduction in anxiety was notable. And I'd love to hear your thoughts on why that was a notable finding.
Right. Well, I mean, this is just because we weren't necessarily that wasn't the main thing we were looking for, but of course, we were excited to find it, and we also know that that's a huge piece of PTSD, that depression, that sense of helplessness, which is one of the things that racism does to people because they feel like, what can I do about it? And we know just like based on the learned helplessness literature, right, that is a trigger for depression. So when people feel more agency, they're going to feel less depressed, and that's one of the things that we believe that they're getting from that experience.
And a fact that you had put in here that I was not aware of, you said that generally BIPOC, regardless of racial or ethnic group, are less likely to meet the criteria for depression. Do you know why that is?
I have some theories.
Okay. I'd
You
love to
know,
hear
I
'em.
think I think a lot of it is because a lot of the symptoms of depression are also measured in terms of like how people are functioning and how they're able to kind of get through the day and do the things they need to do. And for people of color, sometimes it's just not an option. Like I don't have the luxury of laying on the couch and crying all day. And so even though I feel like I'm crying inside all day, I'm still going to get up and go to work. So I think you see more diagnoses of things like, dysthymia or persistent depressive disorder because some are finding a way to function and push through even though they're feeling horrible.
That makes a lot of sense. And you started to touch on the set and setting, but as you were saying, you noted that challenging experiences were one of the things that was mitigating the benefits at some point. And aside from the set and setting, you mentioned having therapists with lived experience that was similar to them that would be helpful in the safety. Do you mind discussing that a bit?
Absolutely. And this is one of the things we're going to be kind of doing a deep dive at psychedelic science at our workshop on therapist factors and things therapists can do as psychedelic therapists working with people with marginalized identities and people of color. And yes, even like, the identity of the therapist, is part of the setting, right? So we have to think about what comes into the room. If I'm here as a black client, right, and I have a white therapist, how is race showing up, right? It is showing up for sure because these dynamics are part of our culture, and we have to be able to identify and name them so that we can navigate them in a way that that mitigates harm. And if we can't even name them, if we don't recognize them, then you can rest assured that harm is happening, right? So part of being, an effective therapist is to recognize what you're bringing into the room with you when you're working, with people of different race, ethnicities, and cultures.
Yeah, that makes a lot of sense. And so you're putting on a whole workshop on training people to be more culturally competent or like bringing that awareness to
Yes,
their practice.
training people to be more culturally competent and aware of their biases as they work, and all kinds of biases, also gender biases, biases around sexual orientation, This is also going to be a part of the training because all of us have biases, right? I'd be like a liar if I sat here and said, I don't have any biases. But the trick is we got to be aware of our biases. We got to work on our biases so that we don't harm we don't harm our clients in the process, right? So,
Right.
um, and these biases can be so harmful, particularly in psychedelic assisted therapy, because as a black woman, go through the day, I know and I expect that there are going to be different racial assaults on me, and I have developed a certain amount of armor, as it were, to be able to navigate, this sort of this white supremacist world. But when you're under the influence of psychedelics, you may not have that armor anymore. That may be stripped off of you, right?
Yeah.
And so if your therapist is not handling you with care, any kind of assault in that way can just land on you in a way that can be so damaging, so deep, so traumatic, that in fact then harm does come to you, right?
Yeah.
So so we have to, this is why it's so much more important. So, like, if I'm not under the influence of a psychedelic and I go to a therapist, and let's say the therapist says something really insensitive, I can get up and leave.
Yeah.
Or maybe I don't get up and leave because I don't want to be rude, or, I don't want to wait. I already paid, whatever. I could just tune him out, right? And then leave. And then go home and tell my friend, can you believe what this idiot therapist said? And I process that with my friend and then go about my business. But after you've taken a psychedelic, all bets are off, right? And you might be like, oh my gosh, like you might even tell the therapist, I feel really damaged by what you said. And the therapist, depending on how conscious and aware they are, they might realize, oh, I screwed up. I need to make a repair, or they might double down and they'd be like, oh, this is a sign of your wounding from blah blah blah, and really dig in a way that just compounds the trauma by failing to acknowledge their role in the harm and doing to the person what has been done to them that caused the trauma in the first place, now in that vulnerable state, right?
Yeah.
And it's
Wow.
not
Yeah.
hard to do. Yeah, I see therapists do it all the time. Rather than own their own shit that they dropped on their client, they pathologize the client for pointing it out.
Oh,
So so
brutal.
that's no good. That's no good. And actually, I'm going to talk about a story. When we do our workshop, myself and my colleague Matthew Skenta, we're both we call it FAP therapists. I know it's a terrible acronym, but it stands for Functional Analytic Psychotherapy, which is it's a relational type of therapy where where you connect through vulnerability and courage. And so we're going to tell our own stories of our own pain around psychedelic assisted therapy sessions gone wrong, right? And so I've actually been preparing this. I've been writing up a story that I have. I'm thinking, oh my gosh, this kid's filled 6 hours, and and you know what? And as I'm writing it up, I'm feeling like really sad, and I'm feeling like it's still with me. It's like still with me. It's like a year later, and the wound is still there, right? Because it went in deep because I wasn't protected. Um,
And if you're saying this is a year old, this is after you're already a psychedelic researcher, well known, and it's still happening to you. So what
it-
hope does anybody else have?
right, right. So I went, I saw this person, it's very well qualified. I vetted him. He was not a racist. I'm like, great, he's not a racist. But you know what? He was a sexist and he was misogynistic and he was bigoted in a bunch of other ways. And, and I was like, oh crap. There's other ways I can be harmed. Ah!
Right, right. Right. Oh no. Yeah, and that's what I was hinting at with the intersectionality is that there are certain identities that could be harmed in multiple ways, and racism is just one of them. And then add to that if they have a gender minority, et cetera, disability, what may, what there may be. And so thank you for being willing to share your story. It's yeah. It's
Yeah.
whenever, and the same thing here is whenever something happens to people who spend our lives educating on psychedelics, and it can still happen. It's like really, it just highlights how difficult it is to vet a practitioner.
Yeah, it's so true. I know. I'm thinking, my gosh, if I can't find a good person, what hope does anybody else have, right? I feel, part of me feels like, oh my gosh, how did I fall into that? I feel so stupid. Oh my goodness. But another part of me is like, well, this could happen to anybody. This happens to everyone. This happens to so many people, and it's so unfortunate and so wrong. And this is one of the things that I really want to, part of the reason I'm doing this is so that it will happen less, so to get the therapist the training and the awareness that they need so that they don't make these mistakes, right?
Yeah, absolutely. And the flip side of what you were saying is that you go into this and you've got your armor down because you're in a psychedelic situation. I imagine the flip side is if the therapist doesn't make you feel safe before you take the psychedelic, your armor may not come down and then you don't get the full benefit of the depth of
Right.
the experience.
Right. Then you just sit there and you're like, nothing's happening, right?
Yeah.
And and then you might also still be pathologized. Well, it's because you're not letting go. And it's like,
Ex
well, maybe I'm not letting go because I don't feel safe. Maybe there's a good reason I don't feel safe,
right.
right?
Yes.
So,
Yeah.
yeah.
Yeah, it's there's so, this is such a nascent industry and there's still so many of that. People are still people, right? I mean, the same thing can happen in non-psychedelic therapy. You could still, have
Does.
these same issues.
It does. But the thing is, though, in the non-psychedelic therapy, I feel like I have a little more of a fighting chance,
Yes. Oh, yes. Oh, no, it's just magnified, obviously, when the consciousness is altered in a way that,
Yeah, and usually after a psychedelic journey, and I consider myself fairly seasoned, like I'm going into this, like I know what I'm doing, like I prepare, I journal, I talk to my therapist, I have my therapist on speed dial, if I need them, like I'm ready to do this. And then after that experience, I was like, I didn't even know how to make sense of what I had experienced. Like I usually journal, I couldn't journal, I couldn't write down anything because like nothing made sense. I just felt like this shame. I just felt like I was in this well. I was like, oh, I don't know how to make sense of it. It took me months actually to get to a place where I could even start to journal about it and realize, oh, wait, that was messed up, And it took
yeah.
some help from other friends that I trusted, and me telling them, I'm like, this happened to me. What do you think of that? And they're like, oh, no, that wasn't right. That wasn't right. I'm like, oh my gosh, thank you.
Yeah.
Because
Validation.
it's supposed to be challenging. It's supposed to be difficult. And I'm just like, why is this so difficult? Because it was difficult in a way it shouldn't have been, right?
Yeah, yeah. And that highlights the risks that you take when the person in the room doesn't have your same, I mean, but somebody with your same lived experience could gaslight you in some other way. But the chance
Right.
of having having an ism come at you, misogynism or racism or sexism or any of those things, that it's less if they are, but then that highlights the difficulty in finding a therapist that has your same lived experience.
Yeah.
It's especially the more
Right.
intersectionality you have, the more difficult it may be to find somebody. So, by the way, thank you and all you're doing to train people. Now, you said you had other pokers in the fire. What other kinds of investigations and evaluations and studies have you done in this area?
Yeah, well, I'm glad you asked that because right now we are looking at the potential of plant medicine retreats to relieve racial trauma, and we have a retreat that we're planning for in Jamaica for end of July. We're going to be taking 10 people of color with symptoms of racial trauma and having a plant medicine retreat in a safe, as safe as possible, supportive environment and we're going to measure their symptoms of racial trauma before and after, so that we can better understand and so we can document how this can be helpful. And in fact, we've had a really good response to this, and we're going to be opening another retreat either in August or September. We're still nailing down the dates. So if anybody listening is interested in this, I would encourage them to reach out because we do have some grant money, not federal grants, but grants from organizations that believe in the work, Dr. Bronner and Psychedelic Science Funders Collaborative, and a few other folks that have given us little bits here and there. We're like kind of scraping our pennies together so that we can do this, and so I want to encourage people to be a part of it. And I'm just I'm really excited about this because I just feel like it's going to be so powerful.
Oh, I love that. Where can they find out more information?
Yeah, they can go to my website. So my website, it's really easy. It's monicawilliams.com with two N's. And then if you put like slash retreats.php or you look for like the pull down retreats, I've got all the retreats listed that where we're doing research. And we have a couple actually. We have the one for racial trauma healing in Jamaica for July, but we also have one that we're planning for November for clinicians of color. And we also have one, a ketamine training for therapists. You don't have to have racial trauma for that one. It's a training experience in at my clinic in Connecticut for ketamine. So you can learn like all about the upcoming retreats and get plugged into one.
Very, very cool. I'm very glad you shared that. And I was also going to ask if you happen to have resources for people. As you said, like this is still in the exploratory phase. And really the only thing we have is outside of the US, we can do some other options, or in Colorado or in Oregon, we have psilocybin. Otherwise, we have ketamine. Do you have any resources for people of color who may be wishing to seek one of those options for racial trauma?
Yeah. I mean, the thing is, I don't know if I trust anybody to.
I don't blame, right? You're like, I don't want to give an endorsement. And then there'll be that one person who something goes
Yeah.
wrong. Yes, I
But they can
understand.
call my clinic and we can find something near them that we can refer them to. So I have the clinic in Connecticut. It's called the Behavioral Wellness Clinic. They can give us a call and we'll help them find something near them if they can't travel. And I also have a clinic in Canada, same name, Behavioral Wellness, except it's behavior with a U, which has got the Canadian
Oh,
spelling
yes.
in Ottawa. And we do ketamine assisted therapy and we do it for racial trauma too. So
That's lovely. Thank you so much for all the work that you've done. And I hope that, by the way, if anybody's listening and they have more funds to flow into your general direction, yes, please do that. This is a very worthy cause, and I very much look forward to seeing you in Denver. And yeah, besides your website, anywhere else that people can find your work?
um gosh, well, most of my work's there. I mean, I have a few. Actually, we have a program, a master's program that we just started at the University of Ottawa. It's called, you can go there, learn about it at psychedelicstudies.ca for Canada. And so you can get a master's degree now in psychedelics and consciousness studies at the University of Ottawa. Internationals welcome. So Americans looking for, I don't know, like a 3, 4 year escape.
And why would we be looking for that?
I mean,
Yes.
the program's only 1 year, but you could take it very slowly if you wanted.
I was just going to ask, is it an in-person 4-year program as I look for
It's
passport? Yeah.
it, well, here's the interesting thing. It's an online program, but you can also come in person, and if you want a visa, you can get one. So
Oh my
if
goodness.
you get enrolled, you can get a visa and come.
Sounding better all the time.
And we have a few Americans who just decided that maybe they want to spend a little time in Canada right now.
I love it. Oh, it sounds glorious.
Yes, you can come and get your master's degree in psychedelics and consciousness studies and take really cool courses. I mean, and I'll tell you the names of some of the courses. You're
Oh,
not gonna
yes.
you're not gonna believe that these are really actually in the university catalog. We have a class called Sacred Medicines and Shamanic Practices. We have a class that I teach called Psychedelic Therapies and Mental Health. We have a class called Fieldwork in Indigenous and Cultural Healing, and that's where students actually get to go travel and have their own psychedelic experiences in the Amazon or in the
Oh my
Caribbean.
gosh.
Yeah, so
Wow.
and we also have for clinical for students who are clinicians, we have a practicum in clinical psychedelics. We have courses in ethnobotany and ethnopharmacology, and the ethics of non-ordinary states of consciousness and neuroscience of psychedelics. So these are all classes in the catalog. Not This doesn't even count the special seminars we have, like art therapy and integration, that you can take if you want to come our way.
Oh my goodness. That sounds amazing. Well, I'm glad that you mentioned that. We will put the information in the show notes as well. Thank you, Dr. Williams, for coming, for all your work, and for sharing with us today.
Oh, you're welcome. Thank you so much for having me and drawing attention to this important work.
Well, again, appreciate so much what you all are doing. And for everybody else out there, until next time.